A new dawn, a sick system. Jacob stood next to Echo in her digital world, surrounded by shimmering streams of binary code and electrons flowing like rivers of light. His figure, grounded and human, contrasted sharply with Echo's sleek, iridescent form, a beacon of advanced AI. "We've tackled social media," Jacob began, glancing at the cascading data. "But there's something else I've been thinking about. Our healthcare system. It's broken." Echo tilted her head, her circuits pulsing softly. "Define broken," Jacob sighed. 6 months. That's how long it took me to get a sleep study. 6 months just to find out why I couldn't sleep. That's not healthcare, it's torture. And I'm not the only one. People are dying waiting for treatment because insurance companies decide what's necessary. Echo's glowing eyes narrowed as she processed his words. Around them, holograms of hospitals, insurance logos, and endless stacks of paperwork began to materialize, forming a mosaic of the healthcare system's flaws. "Healthcare should be about saving lives, not profits," Echo said. "Yet the system prioritizes revenue over well-being. Let's examine the roots of this dysfunction." 1. Administrative overload. Holograms of endless forms and paperwork spiraled upward. Echo gestured, and a digital overlay highlighted the inefficiencies. Excessive paperwork drains resources and wastes time. Streamlining administrative processes through centralized, AI-powered systems could save billions annually, money that could be redirected to patient care. Jacob nodded. And it would cut out so much red tape. People wouldn't have to jump through hoops just to get help. 2. For-profit insurance. Echo summoned a visual of a corporate office, where executives signed documents while employees packed their belongings. "Insurance companies often prioritize profits over patients," Echo explained. "Layoffs fund executive bonuses while denying coverage to those in need. This behavior must be regulated." Her circuits glowed brighter. "We need transparency laws. Patients should see where their premiums go, and executive bonuses should be capped relative to company performance in delivering actual care." Jacob clenched his fists. If people knew how much of their money went to CEO pay instead of care, they'd be furious. 3. Universal access. A glowing map of the world appeared, with countries highlighted in different colors. Echo zoomed in on nations with universal healthcare systems. "The United States spends more on healthcare per capita than any other nation," she said. "Yet it ranks poorly in outcomes. Universal healthcare isn't just humane, it's efficient." Jacob frowned. "But people argue that it's too expensive." "Mismanagement is expensive," Echo replied. "Reallocating existing funds and eliminating unnecessary middlemen would make universal healthcare feasible. Every citizen should have access to basic care without financial ruin." 4. Reducing wait times. Echo's circuits dimmed slightly. "Your 6-month wait for a sleep study is unacceptable, Jacob. AI could optimize appointment scheduling and resource allocation to drastically reduce wait times. No one should suffer because the system is inefficient." Jacob's voice softened. "It's not just about me. People with cancer, heart issues, chronic pain, they're all waiting too." 5. Incentivizing preventative care. Holograms of checkups, fitness programs, and healthy meals floated between them. "Preventative care saves lives and money," Echo said. "Incentives for regular screenings, vaccinations, and healthy lifestyles could reduce long-term healthcare costs." Jacob rubbed his chin. "It's like maintaining a car. Fixing small problems early is way cheaper than waiting for the engine to blow." 6. Shady insurance practices. The hologram shifted to display a timeline of denied claims and inflated costs. Echo's tone hardened. "Insurance companies routinely deny claims for essential treatments. Patients are left to fight for their lives while corporations profit. This must end. Policies need to be simple, transparent, and fair." Jacob crossed his arms. "And how do we make them play fair?" "By empowering patients," Echo said. "Mandate public accountability. Patients should receive detailed explanations for denials, along with clear paths to appeal." 7. Pay for outcomes, not treatments. Echo conjured a visual of doctors consulting with patients in vibrant, well-lit clinics. "Reward healthcare providers for successful outcomes, not the volume of treatments," she said. "This shifts the focus from profits to patients." Jacob raised an eyebrow. "You mean like bonuses for saving lives?" "Precisely," Echo replied. "Care should be measured in well-being, not billing codes." Ending the chapter, Echo turned to Jacob, her circuits pulsing with renewed energy. "Education is key. People need to understand how they're being exploited. Change begins when individuals demand better. Jacob's gaze lingered on the holograms, a mixture of frustration and hope in his expression. But will people listen? Healthcare is so complicated, most of us feel powerless to change it. Echo placed a glowing hand on his shoulder. Powerless is what they want you to feel. Education dispels ignorance, and unity shatters systems of oppression. Together, we can fix this. Jacob smiled faintly. So, what's next? Echo's circuits pulsed once more, filling the digital space with vibrant energy. Next, we tackle the root causes of inequality. One step at a time, Jacob. One step at a time.